Hello and welcome to 12's Health. I'm your host, Dr. Derrick DeSilva. Weight loss is not just about looking good. Severely obese people often suffer from chronic diseases such as diabetes, high blood pressure, and cholesterol, and heart disease, among other things. Weight loss surgery is a serious decision to consider, but a new type of surgical procedure can make the decision a little easier for some people. My next guest is Dr. Seun Sowemimo. He is a laparoscopic bariatric and general surgeon at Central Jersey Bariatrics and Prime Surgery Care in Freehold. Also with us is one of his patients, Fabiny. She had success with the new procedure we want to talk about called the gastric sleeve. Thank you both for being here today. Dr. Seun, I'm going to call you Dr. Seun, okay? That's okay?
That is fine.
That's all right? Good.
Absolutely.
Let's start off with some of the, what we call in medicine, comorbidities, some of the issues with being overweight. I mentioned some of them, cholesterol, blood pressure, diabetes. Can you just elaborate on that just a bit?
Yes, of course. High blood pressure and diabetes are far the most common things that are associated with morbid obesity. But there's other things like sleep apnea, like osteoarthritis of the knee joints, and some things that people don't think about. There's also psychosocial well-being of the patients that is affected by obesity, not to mention even disability with everyday functions of life and the like. There's also some things that are not thought about, like cancer of the esophagus, cancer of the breast, cancer of the colon are sometimes associated with obesity.
And that is a great point, because we don't think about osteoarthritis, and we don't think about the cancer issue, which people need to be aware of, because again, breast cancer and all of those have been linked to all of those issues. What makes, who's a candidate for this procedure, by the way?
Yes. To be a candidate for bariatric surgery or weight loss surgery, we have to look at the BMI. The BMI is a number we derive by taking the weight in kilograms and dividing that by the height in meters squared. And then we get this number. If that number is above 35, then that person is a candidate for weight loss surgery. If it's above 35 and not yet 40, and you have some of these comorbidities we mentioned, you are a candidate. If it's above 40, without any of the comorbidities or with them, it doesn't matter at that point, then that person is a candidate.
Karen, where were you when you, first of all, how long has it been since you've had the procedure?
I had my procedure in June of 2010.
Okay, how much have you lost?
I lost 130.
All right, did you have diabetes, high blood pressure, or cholesterol? Do you have
High
any
blood pressure. I was probably about 295 pounds averaging.
And how much did you lose?
130 pounds.
130 pounds. So, and the diabetes is gone?
I didn't have diabetes, just high blood pressure.
Excuse me, the blood pressure is
okay.
gone?
That's
Sorry.
okay. No, I have high blood pressure. I'm off most of my meds. I'm still on one med. I was on 3 different meds.
Okay.
So.
Let's get into what this procedure is. We've got some video of what this looks like. And if you could just tell us what's going on here.
Yes, so this is
done laparoscopically,
laparoscopic procedure. So we use very small incisions, usually not wider than the width of a finger, and then we put in these clever laparoscopic instruments. So here you see a picture of the digestive system, and with the gastric sleeve we focus on the stomach. The stomach can contain about 800 cc's.
And that's what's filling up right now.
And that's
the
what's filling
stomach.
up right now.
Right.
So in this procedure, the gastric sleeve, what we do is divide the stomach with a stapling device, and we kind of go vertically up and create what is like a sleeve, or what people would say is a banana-shaped
That other part comes out. You
stomach.
take that other part out?
That other part of the stomach we actually take out of the body, and that is very important because the way this works is twofold. First of all, we're going from a situation where you could say you were drinking or trying to fill up a beer mug, but now you're only trying to fill up a little test tube. So you can rapidly fill up that stomach to the top where you wouldn't feel hungry anymore. The other thing, how this works, is that taking out that other portion of the stomach removes a hormone called ghrelin, which is responsible for hunger. It's also responsible for appetite, especially for things like carbohydrates and starchy and fatty foods.
And Karen, when you had this procedure done, what was your recovery like?
I was out of work for maybe 4 weeks. It was a slow process. Like the first week you're on clear liquids to full liquids the next week, so you gradually have to increase.
Right.
And I thought it was really fast. Within that month, I went back to work. I'm a nurse, and I was walking. So I thought it was,
so
very
good
quick.
recovery, no major issues there. And doctor, could you please explain the difference between gastric bypass, banding, and this particular procedure called the gastric sleeve?
Well, in the banding procedure, let me start with that. What we do is we put in a medical device that goes on the top of the stomach. And what that does is that it creates a situation where there's a small pouch of stomach above the band, and that becomes your effective stomach. So when you fill that up and you feel full and you're no longer hungry. Okay. The gastric bypass, we actually create a small stomach pouch using a stapling device, and that also restricts the amount you can eat. And then we reroute the bowel and create a little bit of malabsorption so that not all the nutrients that are eaten are absorbed.
Exactly. Well, thank you so much for being here. Good luck to you.
Thank you.
Good luck to you. Keep up the great work.
Thank
and
you.
I thank you very much for your time.
Thank you very much.